Now, about 1.5 years ago, we did the L4-S1 fusion. First, I'm going to turn around and show the pictures here where we put big screws in the S1, and this is the spacer in the 5S1. These are the screws in the L5, and these are screws in the L4. And I see here that the bone in the 4-5 and as well 5S1, they're fusing, what we call it, or growing together. And here's the side view. Let's first, and here's the front view of the same. Let's first talk about your symptoms before that surgery, and how did the surgery go?
Symptoms before the surgery, like I could take myself to work. By the time I was done doing an 8-hour shift, I had nothing left.
Okay.
Tired, lots of pain, basically eating ibuprofen.
Yeah, yeah.
And then I had the surgery on July 27th.
How long did you stay in the hospital after the surgery?
Just
1 night?
Nope. I ended up staying for 2.
Okay.
Because I couldn't. I don't remember exactly what it was, but I ended up staying for 2. But literally, the last pain that I had in my bag was the day before the surgery.
Yeah, yeah. So surgery worked well for the pain you had before.
Absolutely.
How long after the surgery did you walk? Did you walk same day? Yeah, long time ago, I know.
Same day or the next morning.
Yeah. Now, I'm seeing you now for a different problem.
Right. Yep.
Now, I'm just going to turn around here again and go down to your sacroiliac joint. We see that the dark line inside of the joint and the ruggedness indicate that we have a problem with your sacroiliac joint. But I think important news or information for most of my patients is pictures alone does not make a diagnosis of the sacroiliac joint. And tell me, how did we diagnose your sacroiliac joint? First of all, what are the symptoms of the sacroiliac joint?
So after my spine surgery and that pain went away, I started getting a really heavy feeling in my left leg. Lots of pain toward like the back side of my would be my hip, I guess.
Yeah.
And then I can't sit for very long without my leg falling asleep.
When did that happen? When did you start having all that symptoms?
I'm gonna say less than 6 months after my spine surgery.
Okay. And unfortunately, that's a time frame, 6 months to a year after surgery. Many patients do complain about this kind of symptoms. But how did we figure out it's your sacroiliac joint?
CT scans.
Yeah.
And then
the injection.
And then the injections and the information on where the pain was and whatnot.
Yeah. Well, literally there is a protocol now to diagnose the sacroiliac joint, and we run the protocol, and at every step you qualified, but specifically the injections.
Yes. Yeah.
Tell me about the injection.
I first got injections in the left and the right SI joints. The right side,
because the symptoms were on both sides.
Yes.
Right?
Yep. And then after the first injections, the right side actually has done quite a bit better. There's still off and on pain, but now I only had injections maybe 6 to 8 weeks ago, and my left side still hurts. Like it's just started hurting really bad again. It's hard to sit for any length of time without moving.
Yeah.
My leg goes numb. There's lots of tingling, all that kind of thing.
Well, the idea here is, first of all, that you have 2 sacroiliac joints.
Right. Yep.
And we do what we call diagnostic injection, which is practically numbing up to see if the pain goes away. But when we do that, I always put as well steroid. Steroid can sometimes actually fix it, meaning that what we are seeing here, that on the right side, steroid actually probably fix it, so you don't have much symptom there anymore. The left side seems that it didn't fix itself, so we have to go to the next step. But the whole idea of that is, whatever part of the pain that goes away when we numb up that joint is coming from the sacroiliac joint, because the problem of the sacroiliac joint and spine, they can be similar, they can feel similar, they can present in a similar way, but obviously these are 2 distinct different problems. So we have a positive diagnostic, and for the left side we are planning to go and fix it. And unfortunately, this is a common problem for many patients, and many surgeons are not trained to treat the sacroiliac joint. They would call a situation like that like failed back syndrome, meaning that the surgery didn't work, but not considering that this is actually a new problem.
Right. Yep.
So any other question or comment?
Nope. I'm just glad that things are starting to
Yeah.
look up.
Thank you very much.